Hello and welcome to our discussion about cranial nerve assessment. In this video, we'll be discussing all 12 cranial nerves, how to test them, and as well as the normal responses for each assessment test. To start off, we have cranial nerve number 1, also known as your olfactory nerve. This is a pure sensory nerve which functions for the sense of smell or the sense of olfaction. This nerve exits through the cribriform plate of the ethmoid bone. So basically, in order to test cranial nerve number 1, you're going to have to assess the patient's sense of smell. It is important to note that when choosing which odors to have the patient identify, you must choose the ones that are common and are non-irritating. So to start off, you have to ask the patient to inhale and exhale with both nostrils and then test each one. Inhale and exhale to see if anything is occluding the airway. If airways are clear, ask patient to cover their eyes and to cover one nostril. Next, have the patient identify which odor they are being made to smell. If cranial nerve number 1 is intact, the patient should be able to give the name of the material they are being made to smell. Do the same to the other nostril and to the other scents. Up next, we have your cranial nerve number 2, also known as the optic nerve. This is also a pure sensory nerve which functions for vision or for the sense of sight. This exits through the optic canal of the skull. In cranial nerve number 2 assessment, you're actually testing for visual acuity, peripheral vision, and central vision. In testing for visual acuity, you will need a Snellen chart. So the one here we found online. You can do the same and you can also have it printed. So the patient reads out loud each letter from each row from a certain distance. Normally, the patient should be able to see clearly up until about the 6th line. Next, we have the Ishihara test plate or the Ishihara chart to assess for dyschromatopsia. So just have the patient identify or read out loud the number or letter inscribed in each picture. So next, we have your confrontation test. Before anything else, make sure that you're positioned properly, not too far away from the patient and not too near, just sitting facing each other, knees to knees, and at eye level. So the first step is to check for gross visual acuity. With both eyes open, ask the patient to look at your face and determine if some parts of the face are missing. Another way to check for gross visual acuity is to hold your 2 hands up, palms facing the patient, and have them identify how many hands you are holding up. Now for the confrontation test proper. Ask the patient to cover one of their eyes, and the physical therapist must cover the contralateral eye. This means that if the patient covers their left eye, the PT should cover their right eye, as if mirroring the patient. Next, we assess each quadrant of the tested eye by holding up a number of fingers for each quadrant and having the patient identify what the number is. Now you test the contralateral eye as well. Following the steps again, test each quadrant for the right eye this time. The PT also has to cover one of their eyes to establish a reference of correctness because you are comparing essentially your line of vision with your patient's. Next, you will need to prepare a white target. So for our example, we used a white pen. The patient covers one eye again, and this time the PT's instruction is to ask the patient to tell me when the white target will appear in your vision. The white target is moved diagonally in each eye for each quadrant. Repeat the test for the other eye, and the same thing. Ask the patient to tell you when the line of vision is able to see the white target. Next, prepare a red target. So for here, we used a red ball pen. This time, we will be testing for the blind spot. Have the patient cover one eye, and this time the movement of the target is from side to side and up and down in each quadrant. You will need to ask the patient when the target disappears and when the red target reappears in their line of vision as you move through the motions left, right, and up and down in each quadrant for each eye. For each test, please ensure that you are assessing both eyes. Next, we will assess accommodation reflex. You just need a pen light to do this test. In the absence of a pen light, your cell phone flashlights will do. You're basically assessing if your pupils will constrict with bright light. Don't forget to cover the non-tested eye. And just swing your pen light across the tested eye. Normal reaction is constriction to light. The next cranial nerve is CN3, your oculomotor nerve. This is a pure motor nerve which functions to raise the upper eyelid, turn your eyeball upward, downward, and medially, and constrict your pupil, as well as for eye accommodation reflex. This nerve exits through the superior orbital fissure of your skull. So now a short video on the reflexes involved in CN2 and 3.
Examine the direct light reflex, the consensual light reflex, and the accommodation convergence reflex. Dim the lights and ask the patient to look at a point on the wall behind you. Place one hand vertically along the patient's nose to confine the light to one eye. To test for the direct light reflex, shine a bright light into the right eye and observe for pupillary constriction in that eye. To test for the consensual light reflex, shine the light again into the right eye, but this time observe for pupillary constriction in the left eye. Repeat the same procedures on the opposite side. To test for the accommodation convergence reflex, hold your finger approximately 6 inches in front of the patient's face. Ask the patient to look at the wall behind you and then to look at your finger. Observe for adduction of the eyes and pupillary constriction when they focus on your finger.
Next, we have your cranial nerve number 4, also known as your trochlear nerve. This is a pure motor nerve and functions in assisting turning the eyeball downward and laterally. It exits through the superior orbital fissure as well. Next up, we have cranial nerve number 6, also known as your abducens nerve. This is a pure motor nerve as well. Its function is to innervate the lateral rectus muscle, which turns the eyeball laterally. It exits through the superior orbital fissure as well. So cranial nerves 3, 4, and 6 are usually tested together, and they determine equality and size of the pupil's reaction to light, presence of strabismus, ability of the eyes to follow a moving target without head movement, and the presence of ptosis in the eyelid. So here is a list of your 6 eye muscles which are important to help you with your cardinal gazes. To test for saccadic eye movement, just ask the patient to look up, look down, look to the right, look to the left, look up and right, look up and left, look down and right, and look down and left. So this is essentially assessing if they can move their eyes. Normally, the patient should be able to look towards the direction they are being asked to look without any difficulty. Next, we have the pursuit eye movement. The instruction this time is to ask the patient to follow your hand as you move it towards the range of an H motion. So that's up, down, across the midline, horizontally, and up, down, towards the other side. Normally, the patient should be able to follow towards all directions without any difficulty. Next, we have CN5, also known as your trigeminal nerve. This is a mixed nerve. This means it has sensory and motor functions. These mixed functions span across 3 branches, your ophthalmic, maxillary, and mandibular. The ophthalmic branch exits through the superior orbital fissure, while the maxillary exits through the foramen rotundum, and the mandibular branch exits through the foramen ovale. Generally, it is for sensation of the face and for innervating the muscles involved in mastication or chewing. So for assessment of CN5, you're mainly going to test sensation of the face to sharp and dull discrimination and light touch, opening and closing the jaw against resistance, and your jaw jerk reflex. First, we examine the ability of the face to determine a sharp or dull sensation. You may use the sharp tip of a neurohammer for this one or other alternatives. Be careful not to injure your patient. For CN5, make sure you are testing each branch by swiping across the forehead, near the cheeks, and near the mandible. This way, you are able to determine if all 3 branches of CN5 are functioning well as to sharp or dull sensation. Next, let's test for light touch sensation. You may use anything that is soft like a cotton ball, or a handkerchief. So the same procedure, make sure you are testing all 3 branches by swiping across the forehead, the cheek, and near the mandible, and compare it to the other side. Make sure that the patient is able to identify what the type of sensation is being tested on them. Next, let's test for your corneal reflex or your blinking reflex. Ideally, a cotton wisp is inserted into the eye, which normally stimulates blinking. For the motor function of CN5, you have here the primary muscles of mastication or chewing. To test if these muscles are working, simply ask your patient to open and close their mouth as you palpate their muscles. Next, have them open their mouth against resistance.
Now ask them to move the jaw to the right side and hold it there while you press against the jaw. Repeat on the opposite side and compare the strength of resistance. To perform the jaw jerk reflex, Place your finger on the patient's chin and ask them to slightly open their mouth. Strike your finger with a reflex hammer. Typically, this reflex is absent or only slightly present, therefore making areflexia or hyporeflexia difficult to detect. However, the presence of a hyperactive reflex, with or without clonus, suggests upper motor neuron involvement.
Next up is your cranial nerve number 7, also known as your facial nerve. This is a mixed nerve. This means it has sensory and motor functions as well. It is responsible for the sense of taste of the anterior 2/3 of the tongue, and for its motor function, it is responsible for the muscles of facial expression. In examining cranial nerve number 7, you must examine for any asymmetry or asymmetry of the face at rest and during voluntary contraction. If one side of the face is drooping or is asymmetric, this could mean an affectation of CN7. In testing for integrity of facial muscles, ask the patient to raise their eyebrows, close their eyes tightly, smile with their teeth showing, ask them to frown, and then to puff their cheeks. The sensory function of CN7 is for the sense of taste of the anterior 2/3 of the tongue. So simply prepare a sugar solution and a salt solution and place that on the patient's anterior 2/3 of the tongue. They should be able to identify what the taste is and how it tastes like. You may also occlude their vision or cover their eyes as well. Next, we have CN8, also known as your vestibulocochlear nerve or your acoustic nerve. This is a pure sensory nerve with two functions, mainly for hearing and for vestibular function or balance. It exits through the internal acoustic meatus of the skull. In testing for cranial nerve number 8, you'll need a tuning fork. This vibrating tuning fork will be placed upon certain portions of the patient's head to compare for air and bone conduction. Another thing to assess for cranial nerve number 8 is your vestibular ocular reflex. What you do is you have the patient look at a single point at the center in front of them while you forcibly turn their head to the left and right. Although their head is being turned, the patient normally should be able to maintain looking at the center point as instructed. Up next is your hearing test. So you begin by grossly assessing if your patient can hear at all by the finger rub test. The PT tries to make a rubbing sound by rubbing the index and thumb finger with each other and pulling it away and see how far the patient can still hear that. This next test calls for the use of a tuning fork. This is called the Weber's test. Make the tuning fork vibrate and put it on top of the vertex of the skull of the patient. Then you ask the patient if they are able to hear the vibration equally on both ears. Normal reaction would be equal lateralization of the sound. The next test is known as the Rhine or René's test. This is also using a tuning fork. So make the tuning fork vibrate and put it against the mastoid process of the patient just behind their ear. And after that, transfer your tuning fork just outside of their ear. Do the same for the other side and ask the patient which one is louder. Is it on the mastoid process or is it near the ear? For the vestibular function of CN8, you have your Romberg test. So this test for the integrity of your vestibulospinal reflex or catching your balance when you fall. So one of the ways in which we test for balance is with the Romberg test. So what you do is you have the patient take off their shoes and occlude their vision by closing their eyes, and the PT examines or observes for postural sway. The PT may also challenge the patient by pushing them towards different directions. Next, we have CN9, also known as the glossopharyngeal nerve. This is a mixed nerve. Its sensory function lies with taste on the posterior 1/3 of the tongue, and its motor function lies with swallowing. It exits through the jugular foramen of the skull. Then we have your vagus nerve, also known as your CN10. This is also a mixed nerve. Its sensory and motor functions lie with the major organs of the body. This nerve exits through the jugular foramen of the skull. Now for examination. For CN9, you do this by examining taste on the posterior 1/3 of the tongue, as well as examining gag reflex by inserting a tongue depressor in the patient's throat to stimulate gagging. Next, you have cranial nerve number 10. You examine swallowing by having the patient swallow. So here, as shown, is just testing for the taste in the posterior 1/3 of the tongue. And for swallowing, you may ask the patient to swallow water in front of you to examine the performance of swallowing. They should not have any problems with these functions if they don't have any problems with CN9 and 10. Next, engage the patient in conversation and listen to the quality of their voice. Hoarseness of the voice might indicate problems with CN9 or 10. Next is testing the patient's gag reflex by using a tongue depressor. So just insert your tongue depressor near the end of your patient's mouth and near the opening of their throat. This should stimulate the gag reflex.
Ask the patient to open their mouth wide. Shine a torch into the mouth and ask the patient to say ah. Observe for symmetrical elevation of the soft palate and uvula. Now, ask the patient to swallow some water. Observe the action and ask them to report any difficulty. Finally, ask the patient to cough and observe and listen for any difficulty.
Next, we have your CN11, also known as your spinal accessory nerve. This is a pure motor nerve innervating several muscles, including your SCM and your trapezius muscle. This exits through the jugular foramen of the skull. In order to assess CN11, just resist movements of the major muscles, your SCM and your trapezius muscle. What you see here is testing for the integrity of your sternocleidomastoid muscle. To test for the patient's right SCM, have them turn their heads to the right and laterally flex to the left while resisting that motion. Next, to determine the integrity of the trapezius muscle, just have them shrug their shoulders against resistance as strong as they can. Patient should have strong movements for both SCM and trapezius if CN11 is intact. Next, we have CN12, also known as your hypoglossal nerve. This is a pure motor nerve controlling muscles of the tongue. It exits through the hypoglossal canal of the skull. In examining for CN12, have the patient stick their tongue out or protrude it and examine the movement from side to side and up and down. So ask the patient to stick their tongue out and note for any asymmetry. The tongue should normally be at midline. Next, ask the patient to move the tongue left, right, and up and down and see if the movements are fluid and are strong. Next, ask the patient to protrude their tongue on the insides of their cheek and check for the strength. Then do the same on the other side. And that is all for cranial nerve testing of all 12 cranial nerves. Thank you.